20 million women and 6 million men report they have experienced urinary incontinence in their lifetime. Risk factors for urinary incontinence include, but are not limited to, prostatitis, prostate cancer, giving birth, multiple gestations, assisted labor and delivery, increased body mass index or being overweight, being older than 60 years of age, and smoking. To best understand what causes urinary incontinence, it's important to know how the bladder should work. When you eat and drink, fluid gets filtered through the kidneys and waste moves through the ureters and fills the bladder. The bladder fills and stretches to a certain volume, which creates a stretch reflex. The stretch reflex sends a signal to the brain and lets the person know they need to urinate. Next, the pelvic floor muscles should involuntarily squeeze around the urethra so that urine does not leak out. This gives the person time to get to the toilet. Once at the toilet, the pelvic floor muscles relax, the bladder muscles contract, and urine flows out. This picture depicts the key muscles of the pelvic floor. As an orientation to this photo, this is a view looking down into the perineal area, and the pink area indicates muscles. When these pelvic floor muscles contract, they support the bladder and squeeze around the urethra to control urine leakage. There are many muscles in this area which support and assist with function. Just like we use muscles in our arms and legs to move, we use these muscles to control bowel and bladder function. These pictures depict some other muscles in our core that all contribute to proper function of the pelvic floor. A key muscle that contributes to proper function of the pelvic floor is the diaphragm, which is essential for breathing. Additionally, the many muscles throughout the hip region need to be both flexible and strong as they contribute to urinary incontinence. There are different types of urinary incontinence. Urinary frequency is a condition in which the bladder does not fill to capacity with urine before the stretch reflex is triggered. The stretch reflex triggers more frequent sensations and a need to use the toilet, which ultimately requires the individual to have frequent trips to the bathroom. Urge incontinence is when the bladder lining gets irritated by dietary irritants and results in the bladder muscle contracting. Stress urinary incontinence is characterized by leakage during activities that increase intra-abdominal pressure, such as coughing, sneezing, laughing, lifting objects, running, or jumping. Finally, a neurogenic bladder is urinary leakage distinguished by a neurological condition such as Parkinson's, multiple sclerosis, brain or spinal cord injury. Evidence has demonstrated a link between urinary incontinence and falls among older adults. Urge incontinence is when a person is experiencing a strong urge to go to the bathroom. This may increase their risk of falling when rushing or moving quickly to the bathroom. Urge incontinence is compounded with advancing age and modifiable home fall hazards that may impede safe ambulation to a toilet or bathroom. Fortunately, there is evidence for strategies that can reduce a person's fall risk. Dietary irritants are a source of bladder lining irritation and can result in contraction of the bladder muscle. Controlling consumption of dietary irritants is one way an individual can reduce urge and incontinence. Some common dietary irritants are coffee, tea, carbonated drinks, alcohol, acidic fruits and juices, spicy foods, tomato-based products, and chocolate. Fall hazards inside the home can play a role in an individual's risk for falling. Some ways to modify the home to reduce the risk of falling include clearing walkways of clutter or cords, adequate lighting in rooms and walkways, having non-slip flooring, securing loose mats, carpets, and rugs to the floor, and installing grab bars in the bathroom.
In addition to dietary and home modifications, pelvic floor exercises can improve strength, improve muscular control, and reduce muscular tightness. This video will now shift its focus to general exercises that address pelvic floor health. It is important to recognize these exercises should not cause pain or shortness of breath to a point you cannot carry on a conversation. If either of these symptoms are experienced during the exercise or any other signs that the exercise is not being tolerated, a healthcare provider should be consulted. The first exercise that will be discussed and demonstrated is deep breathing. Deep breathing is useful to bring about pelvic floor muscle relaxation. The exercise begins in a back-lying position and hands on the abdominal area or belly. If it is more comfortable, the individual can lift their knees. This exercise can also be modified to be performed in sitting, but will be demonstrated in laying in this video. In this position, inhale through the nose as if to smell a flower. This should result in the belly getting bigger or pushing outward into the hands. Next, exhale as if to blow out a candle. The belly should go back down and return to the starting position. Repeat this 3 to 5 times prior to starting other exercises, as this technique can be incorporated into the remaining exercises that will be demonstrated in this video. These next 2 exercises will help stretch or open the hip and pelvic floor muscles. The first one is called the modified happy baby or knee to chest. This exercise is also performed in a laying on the back position. Bring the knees to the chest and grab on top or behind the knees to pull the knees towards the shoulders. 3 to 5 deep breaths should be performed while holding this position. The second hip opening exercise is called the child's pose or 4-point sit back. The exercise begins in a 4-point position or on the hands and knees. From this position, the individual bends at the hips to sit the bottom back onto the heels. 3 to 5 deep breaths should be performed while holding this position. If this causes discomfort in the knees, place a pillow under the bottom, like this. The next exercise that will be demonstrated is called the Kegel exercise. This exercise is a technique that activates the pelvic floor muscles. For women, it will result in a feeling of squeezing of the muscles around the vaginal opening. For men, it may feel like the scrotum is lifting slightly as if walking into cold water. To perform this exercise, start by laying on the back with the knees up and inhaling to expand the belly. During the exhalation phase of the breath, tighten the pelvic floor muscles in a way that is similar to the sensation of trying to stop the flow of urine. While holding this muscle tight, continue to breathe normally and count to 5 out loud without holding the breath.
2, 3, 4, 5.
This exercise is repeated 8 to 12 times. An exercise compensation that is unwanted but commonly observed is that the pelvic bone tilting or the gluteal or buttock muscles tighten, as is observed here. This should be monitored during the exercise and corrected if it is observed. The next exercise is called the adduction isometric exercise. It is performed laying on the back with the knees bent up and a pillow between the legs, as demonstrated here. During this exercise, the inner thigh muscles tighten to ultimately strengthen the pelvic floor muscles. Once in position, the individual performs the deep breathing exercise. During this exercise, the pelvic floor is again tightened as if to stop the flow of urine while squeezing the knees together into the pillow. Then, while keeping the pelvic floor muscles tightened and the knees together, slowly exhale for the count of 5 and then relax. Repeat this exercise 8 to 12 times. The next exercise, hip abduction isometrics, is also performed laying down with the knees bent, but in this exercise there is a belt or a band around the knees, as is demonstrated here. This exercise uses the deep hip muscles to activate the pelvic floor. While deep breathing, the pelvic floor is tightened while squeezing the knees outward into the belt or band. Then, while keeping the pelvic floor muscles tightened and the knees pushed outward, slowly exhale for the count of 5 and then relax. Repeat this exercise 8 to 12 times. The posterior pelvic tilt exercise is also performed laying down with the knees bent. Similar to the prior exercises, inhale using a deep breath and then tighten the pelvic floor as if trying to stop the flow of urine. However, in this exercise, the pelvis is rolled under as if to bring the tailbone towards the ribs. Exhale while bringing the pelvis back to the starting position. Remember to leave the hip on the table. This is a subtle movement that may be best achieved by closing the space in the small of the back, as is demonstrated here using a towel. Repeat this exercise 8 to 12 times. The next exercise is called the bridge and is also performed laying down on the back with knees bent and feet on the firm surface. Once in this position, the individual performs the deep breathing exercises while tightening the buttock muscles and pushing down through the feet and squeeze the buttocks to lift the hip up towards the ceiling.
1,
Count to 5 out
2,
loud and hold the exercise.
4.
The hips should only be lifted so high as to feel the pelvic floor muscles contracting and not straining or arching the back.
1, 2, 3, 4, 5.
Lower the hips to the surface and relax. Repeat this exercise 8 to 12 times. It is recommended the sit-to-stand activity be used in conjunction with pelvic floor muscle activity, as it is helpful to translate pelvic floor muscle activation into everyday movements. This activity can also be useful to use when the urge to urinate is felt, but the individual is afraid of leaking prior to making it to the bathroom. The exercise starts in a seated position. The individual slides the hips forward to the edge of the bed or chair and places the feet on the ground. Once in this position, the person performs the deep breathing exercises. On the exhale, the individual bends at the hips so that the nose goes over the toes, and then uses their arms and legs to assist in rising to a standing position while keeping the pelvic floor muscles contracted. Once standing up tall, the pelvic floor muscles can be relaxed. The reverse process is used to return to a seated position. The individual performs the deep breathing by inhaling and then tightens the pelvic floor. The person then bends at the hips and knees so the nose goes over the toes and reaches back for the chair or bed to sit down. Once seated, the pelvic floor can be relaxed. Repeat this activity 5 to 10 times. The last exercise is called the mini squat and again uses pelvic floor muscle activation. This exercise begins in a standing position. Once in this position, the individual starts again with deep breathing to ready the pelvic floor muscles for the exercise. Then bend at the hips and knees, keeping the back straight throughout the squatting movement. Then return to standing. The goal is to try to hold the pelvic floor contraction for 10 mini squats, but it is fine to take a break after a few and then restart. It is important not to hold your breath, and it is often helpful to count out loud. This exercise is repeated 8 to 12 times.
Let's consider how using these muscles may help reduce incontinence and ultimately reduce the risk of a fall. As mentioned earlier, the pelvic floor muscles support the bladder and closes off the urethra where urine comes out. Urine leakage with activity can be reduced as the pelvic floor muscles are strengthened. Additionally, muscle strengthening exercises can result in the muscles becoming more effective at closing around the urethra to stop urine leakage. Practicing contraction of the pelvic floor before or with activities that cause leakage can reduce the burden of urine leakage. Give it a try. Try to contract your pelvic floor muscles and cough. Try to contract your pelvic floor muscles and laugh. If urine leaked with these activities, it suggests your pelvic floor muscles may not be strong enough yet to stop leakage. Urge management techniques are used to retrain the bladder to decrease how often you go to the bathroom. We can use the pelvic floor muscles to decrease the number of times you go to the bathroom in a day or at night. One urge management technique to decrease urinary leakage when walking to the bathroom includes the following. Stand still or sit if you can. Think of something other than going to the bathroom. Contract your pelvic floor muscles 3 times and notice if the urge to go to the bathroom has gone away. Proceed by walking calmly to the bathroom and use the toilet. You can use this strategy to decrease urinary frequency. While incorporating strategies to reduce urinary incontinence does take practice, with repetition it can become a part of a person's routine and reduce the associated burden of this condition. If you have questions or comments about this video, please reach out to Hop Up PT through our website contact form available on the Hop Up PT website.